Can you talk about what it's like being pregnant here?
Um, so when I first found out I was pregnant, I was terrified because I knew I didn't have insurance at that point. I think I've been cut off from insurance about 4 times. Yeah.
Wow.
In a year. If I'd had the baby here, that's thousands of dollars. The Medicaid that I have covers me while I'm pregnant until I give birth, which includes a hospital stay when I give birth. So if anything goes wrong, I'm paying for every second that I'm in that hospital. I'm paying for everything I use out of pocket. There's a story about this couple from the UK who came to the US on holiday, and the woman was pregnant and she gave birth prematurely. They lost their house because of the bills. They lost their house in England because of the bills. Because she had a baby. So I've been cut off from my health insurance because my because one time they didn't have a particular form that my husband had sent, but it hadn't gotten to the person or something like that. So they cut us off. We were cut off because we moved, and when we called to give our new address, they said that they'd sent us a bill for something that we hadn't paid, so they cut us off for that. And then when we updated with our new address, and I called to do that, but I couldn't really do much because it's my husband's the agent or whatever, so I can't make changes to my own plan. So anyway, so then he called, gave the new address. They entered it in wrong, and so our mail or whatever had gotten sent back to them, so they cut us off for that. I ended up having to get a pretty serious prescription, and when I took it and I saw what I would have paid, and I would have had to pay like upwards of $70 for like a week's worth of prescription. A lot of people can't afford that. My friends that have come to visit from the UK, they always comment on like the homeless people, and they say that it's more oppressive here than it is in England. We have our problems with homelessness, but the amount of them that are like vets or like people that have had to deal with like PTSD or mental health issues, and you know that they're out there because they couldn't afford help or they didn't have access to help, to mental help, and I feel like that's great. It's so ignorant that these companies want to make money, so they make it like unreachable for people who have served the country with their lives for years. They can't even access it. So what is the point? I mean, it's not even perfect now. It feels like if you're below a certain line, you can get healthcare, but you constantly have to prove that you're there. You constantly have to show your earnings, which kind of puts you in a weird situation, because if you want to make more money, then you risk getting cut off from insurance. And then there's this like band in the middle where you earn, like, I feel like there's a gap. There are plenty of gaps where people can fall very easily and have no coverage. Unless you're in like a high paying corporate job, you might get an insurance. And even then, the amount of different levels that your insurance cover is insane to me. Why should I have to spend $4,000 before the insurance that I pay every month kicks in and covers whatever, like dental work or an ultrasound that I needed? And I'm not convinced that Trump Care is going to look after the people that have fallen in between the gaps at all. At all. Think about what is at risk. Really think about it. Really think about it. All of the things that you take for granted, it's a privilege The NHS is a privilege. I feel that people complain a lot about it, but you don't realise how incredible it is to have access to healthcare without consciously having to worry about your finances or getting a bill that's going to like throw you into like thousands of pounds or dollars worth of debt. But what is at risk? It's people's lives. It's not just as, you know, marking like Teresa or Jeremy. It's people's actual lives. I woke up a couple of times in the night because my heart was beating kind of weird. When I spoke to the doctor, they measured my heart rate and they said, well, maybe we'll have to refer you to a cardiologist. Now, I haven't pushed them because I'm worried about how much that's going to cost if for whatever reason they cut me off of health insurance.